do this short one-way discussion. It's 3.5 years since we've done the first liver transplants here at Apollo Navi, Mumbai, and about 8 or 9 months now since we've had the onset of the COVID pandemic. I've been exposed to the COVID pandemic largely in the UK, and this is actually my first visit back in several months. And I'm very pleased to see that the team has taken all the required precautions to be able to continue with transplantation. We've had an impact on transplantation, that is true. A lot of the impact relates to the shortage of cadaveric donors. We were quite short of cadaveric donors before, and that situation has actually become worse over the last 8 to 9 months. For living related, the impact has been different. There's been a lot of apprehension, there's been a lot of fear both in patients as well as in donors and their families. I think just to clear up a few things, we've learned to live with COVID. We think COVID will be here to stay for the next 6, 8, 10, 12 months till we get to a point of effective vaccination for a large part of the community. In this situation, we will have to continue to work with COVID because the main collateral damage for COVID, and this is true all around the world, is that patients with end-stage disease or with cancer that is treatable are the ones who are suffering as much, if not more, than patients who get COVID. And we spend a lot of time educating and convincing people that provided all the precautions are taken, the outcomes are not very different. In the West, we've had COVID a bit longer than what you've had in India, and we've already done quite a bit of work looking at the impact of COVID in transplant patients. The impact is very, very, very low, provided you take the adequate precautions. So careful assessment of donors, careful assessment of recipients, careful COVID testing before as well as immediately before the procedure, periods of quarantine that are as per the guidelines, followed by the operation in setups that take all the precautions as required for COVID. We think the risk for children is even smaller than for adults, and rather than wait for children to become very sick and die while waiting, it makes much more sense to engage with the transplant teams with a view to getting the best possible advice and making the best possible decision to proceed with transplantation at the right time, and to put away fear of COVID as the reason not to go ahead. So in terms of transplant activity here at Apollo Navi, Mumbai, we have managed to continue the activity on both the liver transplant front as well as the kidney front. On the liver transplant side, we are continuing both with adult transplantation and pediatric transplantation, and we've been fortunate to have a few in-house cadaveric donors to allow for cadaveric transplantation to continue. In the city and in the ZTCC, the number of cadaver donors have dropped since the onset of COVID. So it probably will put more pressure on the system to continue with living donor liver transplantation. As of November 2020, we have done some 130 liver transplants, of which around 35 have been in children. And of these, about 4 or 5 have been done in partner hospitals around the region. We're not seeing a difference in outcomes. The one thing that we are seeing is that people are finding it difficult to make a decision, and some people are making decisions that are quite late, when the risks of the transplant operation would potentially grow because both the recipient as well as the fact that they've been in hospital many times are sicker, and that does have an impact on their ability to withstand the operation. I think going forward, as people get more educated about COVID, we will see less reluctance. It's important that as clinicians we educate patients and their families so that as much as possible we take the fear out of the system, so that we can continue to treat these sick adults and young children with end stage liver disease. Thank you.